Welcome to Leadership Academy. We have a special guest with us this evening, Dr. Jimmy Gutman, and we're going to interview him in just a few minutes here. Now, to introduce Dr. Gutman, let's just consider a couple of things here, then we'll begin our interview. The World Health Organization stated in March of 2022 that the COVID-19 pandemic had triggered a 25% increase in the prevalence of anxiety and depression worldwide. Dr. Tedros Adhanom Ghebreyesus, the director of the World Health Organization, Director General, he recently said, quote, "The information we have now about the impact of COVID-19 on the world's mental health is just the tip of the iceberg. This is a wake-up call to all countries to pay more attention to mental health and do a better job of supporting their population's mental health," end quote. Well, tonight our goal is not only to pay more attention to mental health, but to provide all of us with, as an audience, some support by educating us on the effective way of addressing any issues you or your loved ones may be dealing with regard to mental health. And we have the privilege and honor to have with us this evening Dr. Jimmy Gutman, unquestionably the world's leading author and authority on the subject of glutathione. He's a former professor at McGill University Medical School, where his original specialty was academic emergency medicine. He was then appointed as the undergraduate director and residency training director of emergency medicine at McGill University. He was trained at the University of Calgary and did his specialty training at Emory University in Atlanta, Georgia, where he was chief resident. He now serves as Immunotech's chief science officer. He's also chairman of the Scientific Advisory Board for Immunotech. He's on the board of directors for the Canadian Association of Emergency Medicine and has served on numerous other boards dealing with policy and education. And Dr. Gutman is also the author of several best-selling books on glutathione, and is arguably the world's preeminent expert on the role of this critical substance in human health. Dr. Gutman's latest book, The Comprehensive Guide to Glutathione, is considered the seminal work on glutathione research and clinical application. Dr. Gutman has been a scientific advisor to Immunotech for more than 25 years and continues to make strides forward in glutathione research. Welcome, Dr. Gutman. Thank you for joining us this evening.
Thank you, Lou. Thank you very much for the great introduction.
Now, in chapter 34 in this beautiful publication, you talk about psychiatry and the benefits of glutathione for psychiatric disorders. Much of that is new as well. What's caused all the sudden interest in glutathione and psychiatry?
Well, there are several things at play here. Psychiatry now has a huge overlap with neurology, neurochemistry, neuroanatomy, and we're evolving into a larger field that I think might best be called neuropsychobiology or something similar. Advances in biochemistry and brain imaging and other fields have really come a long way, even in the last decade. Although there are still psychiatry purists that focus only on counseling patients, the vast majority of psychiatrists will use these other tools, especially psychopharmacology, a fancy word for drugs. In addition, there's been a push, mostly from the public, all you guys we're talking to tonight, to look into natural products to help relieve some of the symptoms of psychiatric disease. And this has prompted many research to do legitimate clinical trials, randomized, double-blind, placebo-controlled, all that stuff. And now we're seeing the fruits of their labor. So glutathione certainly comes into play here, and there are more and more studies showing its efficacy in quite a few disorders, in fact.
Speaking of these disorders, you spend some time in your book discussing the psychiatric disorder schizophrenia. Is it true that determining a patient's glutathione status could be helpful in diagnosing schizophrenia?
In a word, yes. However, it's not easy finding a reliable and accurate glutathione blood test. You can find them on the internet offered for $30 or $40, but this is really a waste of money. It's not accurate at all. To do it in a proper research lab costs hundreds of dollars. So don't waste your money on these internet glutathione tests. You need to depend on higher level tests, but what you really need to depend on are the studies that are already done. And the studies have been done for years now, demonstrating that oxidative stress or free radicals are high in schizophrenia and glutathione levels are low in schizophrenia. But we know this. This is easy to look up. And moreover, glutathione levels fall even more as the severity of the disease increases. This has all been looked at.
Well, that'll save us some money, thank you. And it's also extremely helpful. But that would imply that measuring glutathione levels could act as a way to determine prognosis in schizophrenia, correct?
Absolutely, absolutely. And this has been studied. There was a multinational team that followed glutathione levels in a group of patients for 7 years. And they were able to successfully predict the development of their psychosis based on glutathione levels. So measuring glutathione could be both a diagnostic tool as well as a tool for prognosis or determining the severity of the disease.
You mentioned earlier that glutathione levels could be measured using newly developed brain scanning techniques. Has this been used looking at live glutathione levels in schizophrenic patients?
Indeed, it has. A Japanese team used a special type of MRI called a magnetic resonance spectroscopy. So they're actually looking at a colored scan of the brain in a living person, to examine glutathione levels in their patients. See, they tuned it to pick up on the frequency of glutathione. And again, they demonstrated that the lower the glutathione levels, the more severe the patient's symptoms were. It's still a very specialized and expensive technique, but I imagine this will be used more and more in the future as the technology gets better and the price comes down.
Mm. Now, here's the question of the century, right? What benefits can someone suffering from this disorder, schizophrenia, expect if they raise their glutathione levels?
Well, this question was asked probably starting around 2008 successfully when an Australian doctor, Michael Burke, used the glutathione precursor in schizophrenic patients. And the success in treating symptoms was evident. And so this spurred on a bunch of more research studies. I believe that glutathione is a good strategy and very much underutilized here. I mean, who knows about that? Only somebody who's crazy enough to look at glutathione and schizophrenia.
Yeah, we're glad we're crazy.
Yeah.
And so here we've got a real issue, don't we? Presently, patients with schizophrenia are often treated with powerful drugs. And although they're good at controlling symptoms, they have terrible side effects quite often. And it's very common and often permanent side effects or long lasting. Now, if a person raises their glutathione levels, will that help with this, with the side effects for the disease? And is there a detox effect that can be taken advantage of here?
Very, very good point, Lou, and thanks for asking. An all too common side effect of major antipsychotics like Haldol or Thorazine is something we call tardive dyskinesia. This is a movement disorder that can cause stiffness. And I guess those of you who have been around chronic schizophrenic patients that notice that they walk funny and they're stiff, and they may be puckering their lips or have involuntary movements of their arms and their legs, which is uncomfortable to look at, but even more uncomfortable to have, and embarrassing. It's been determined that this is caused by high levels of lipid peroxidation. What is lipid peroxidation? It's oxidation of fat molecules. And of course, we know that glutathione peroxide is the major defense against lipid peroxidation. So there you go. Raising glutathione has been shown to alleviate the effects of these drugs. So another great detox example.
That is fantastic. Now, earlier when we opened up, we were talking about the increase in depression with COVID-19, and the WHO, World Health Organization, has determined to give attention to this. So let's move into that familiar disorder, depression. In its varying degrees, depression is all too common today, as stated by the General Director of WHO. Statistics show that over 20% of the population suffer from depression. And he said that that has increased by 25%. So one can only guess at what the numbers are today, but this is clearly an epidemic, and I'm sure you'd agree. Can you comment on the standard treatments of treating depression?
Well, those figures may actually be an underestimate of the prevalence. So clearly, this is an epidemic. And especially if you look at people over their entire lifetime. Now, some of this is these increase in numbers. Some of it is clearly due to more people being depressed, but definitely some of it is due to more people seeking help. So it's less of a stigma now, and some of it is due to it being more diagnosed. But still, there absolutely is a much larger number. Unfortunately, some can be a result of the introduction of new drugs to treat depression and have it backfire. And both the pharmacy industry and the medical community have been pushing these drugs quite aggressively in the past. And let's go back when we were kids, Lou. Most cases of depression went underdiagnosed, and many people would usually get better spontaneously over time, either on their own or with support from their friends and families. However, with the advent of SSRIs and similar classes of drugs, people presenting to their doctors are all too often given a prescription for these drugs, and often inappropriately. These are one of the most commonly prescribed classes of medication. And newer research is showing that these drugs are not nearly as effective as they were originally purported to be. In fact, many studies have suggested that they're actually not much different than giving patients a placebo in many cases. So the standard of treatment nowadays is drug treatment, and results are just disappointing. And so this has driven the search for more natural means of treatment.
Yeah, I had a friend in Arkansas. We lived there for several years, and he suffered from depression, and he was on medication, and it caused suicidal tendencies. I mean, that was one of the side effects, and he ended up taking his life.
Oh, dear. And all too common in the story. All too common story.
Yeah, you hear it over and over and over and over and over and over.
Yeah.
Now, earlier we were talking about schizophrenia and the correlation with the glutathione levels and how it's helpful there. How does depression correlate with oxidative stress, and more particularly glutathione levels? I understand that too has been looked at in several studies.
Yeah, for sure. Well, depression can result from so many different factors. It's some of it can be ascribed to genetics, some to diet, nutrition, much of it's to stress and social environment and other reasons. However, what has been made clear is that oxidative stress, free radical formation, and glutathione depression play a part in this process as well. Whether it's a cause or a result of depression, we know that glutathione levels are low, and the decrease in glutathione levels has been clearly demonstrated, not just blood tests, but again with those specific brain scanning techniques we talked about, and in addition, like the other disease entities we spoke about, there's a correlation that's been made with the severity of depression and the degree of glutathione decrease.
So again, here's the question of the century, Dr. Gutman. What benefits can be expected with depression if one raises their glutathione levels?
Of course, that's the bottom line. And this was again studied by Dr. Michael Burke. He looked at over 250 depressed patients in one study and showed improvement in depressive symptoms by raising their glutathione levels. I mean, very promising. And also, keep in mind that depressed people often are just not taking good care of themselves. And this can result in a lack of exercise, a lack of proper nutritional habits, drug and alcohol abuse, and more. And we know how glutathione augmentation can have a positive effect, helping here as well.
That is so promising, so helpful to know. Even more prevalent than depression, so many today are suffering from anxiety. And in some cases, it's debilitating. Can a person expect relief from anxiety if they increase their glutathione levels?
Yes, this is certainly a major issue. And it, as you mentioned before, dramatically increased after COVID-19. I believe a huge part of the reason is that an individual will visit their doctor these days is related to either anxiety or depression. I've seen studies that show at over half the people that visit their doctors now, it's either anxiety or depression are related. I won't get into the factors of why levels of anxiety have exploded after COVID, but we need to acknowledge that this is a pandemic in itself. There have been studies linking anxiety with levels of glutathione metabolism. Certainly this as well as an area of active investigation. I'll give you one cute study that I came across a number of years ago, looking at anxiety and glutathione levels. What this researcher did was took a bunch of people that practiced transcendental meditation. It's a form of meditation that lowers your stress levels and your anxiety, and compared their glutathione levels with the average person on the street. And the people that practice transcendental meditation had higher glutathione levels. So there you go.
Oh, interesting. I knew a guru. We were in New York together, and he's from India. And he went up to a hot dog vendor and asked him if he could make him one with everything. Now, another serious disorder, bipolar disorder, just so challenging for folks that have that. Can glutathione therapy help with that?
The studies are not as strong as in depression, for example, but it's clear that oxidative stress and glutathione depletion is evident. Glutathione levels have also been investigated as a means of following these patients' progress. There have been studies demonstrating improvements in a variety of symptoms, including activities of daily function, quality of life, increased time between attacks, and even cognitive improvement. But the studies aren't as robust as in depression.
Yeah. Are there any other psychiatric disorders that are addressed by increasing our glutathione?
Oh, certainly. In the book, we name a few more: mania or manic disorder, obsessive compulsive disorder, attention deficit disorder, panic disorder. I need to mention that uh, uh, glutathione is also being used to treat addictive disorders such as cocaine, nicotine, or tobacco, or cannabis, or even pathological gambling. Raising glutathione has shown to be helpful, and I'm sure even more will be apparent as time goes on.
So I have a friend who's a pathological gambler who bets he can quit smoking. Will it help him?
But yes, there it is a reasonable strategy to suggest.
Uh, Dr. Gutman, do you recommend any additional supplementation to assist with these disorders?
Oh, absolutely, absolutely. Let me mention one that may surprise a lot of people: probiotics. Most people think that probiotics is just for gut health. I was at a convention recently where I saw a slide that read, "You are what you eat," and that was crossed out and replaced with, "You are what your intestinal flora eat." In other words, depending on the health of your gut's bacteria, this will affect how your brain works. And we spent a whole day reviewing articles and presentations on how the use of probiotics were being employed successfully to treat both anxiety and depression. The results are just too impressive to be ignored. So a key feature here is that your gut biome, the good bacteria, they are actually responsible for the production of neurotransmitters. Your gut's bacteria can produce does produce neurotransmitters, and this can be modified by diet and, of course, certain probiotics in your favor.
I know that they're referring now to the stomach and gut health, to the second brain, they call it. So,
Yes, the gut-brain axis, absolutely.
yeah, fascinating, isn't it? So it's incredible. I understand that omega-3 has been studied in regards to brain health as well. Does this include affective disorders as well?
It certainly does. Your brain is actually made out of substances similar to omega-3 fatty acids, and it requires a good source of them to maintain proper functioning. Um, Omega-3 has been investigated into depression, bipolar disease, postpartum depression, anxiety, even attention deficit disorder. So, being that there really is very little downside to taking omega-3 and many other positive benefits, I believe that it should be at least tried by people suffering from these problems.
Any others?
Oh, well, we could talk about adaptogens like rhodiola. We could talk about minerals like magnesium. We could talk about melatonin and many other natural substances. We really need to look at almost everything we put into our body when we're looking at what can affect our mood and our thinking.
Well, this is all so very helpful. Dr. Gutman, in conclusion, what recommendations do you have for our audience who are suffering from psychiatric disorders?
Well, let's start with some very basic steps. I may sound boring, but it's just the honest truth. Eat well, sleep well, try to avoid too much stress, get regular exercise. I can't stress enough the importance of these lifestyle issues towards mental health. This is where your first focus should be. And also, don't hesitate to reach out for help. It's much less of a stigma now, and people are much more open-minded, whether it's friends or family or for support, or someone who's adept at counseling. Drugs are a consideration in severe cases, but be aware that they are likely too often prescribed, and more basic interventions should be employed first. And of course, part of these interventions should be dietary modification and the use of appropriate supplements that you've given me the opportunity to talk about tonight. So thank you very much.
Dr. Gutman, thank you. It's been a pleasure to be able to speak with you for the past half hour or so. And the information you provided us with is just so helpful, so practical, so very useful. And I'm sure it's benefited everyone here in attendance.